I'm Dr. Mark Escott. I'm the Interim Health Authority and Medical Director for Austin Public Health.
First, you just want to tell us about what you guys have learned today in the release about rubella.
So this week, Austin Public Health identified its first case of rubella, or German measles, since 1999. So in under 30 days, we've seen the second vaccine-preventable disease that we haven't seen in 20 years in a very short period of time.
What do we know so far about how this person got infected, where this person got infected? Can you tell us those details as much as you can?
Sure. So the vast majority of cases in the United States, including this one, over the past decade, have been obtained overseas. So this individual traveled to Thailand and returned to the United States and brought the disease here to Austin.
That's, like you said, that's typical for how we see rubella coming into the U.S.?
Yes, yes. Again, we see less than 10 cases a year in the United States on average, and only 3 cases last year in Texas. So all of those cases, the vast majority of those cases over the past decade or so, have been brought in from outside the United States.
This is like measles. I mean, if you get your vaccination, 100% effective.
It is almost 100% effective. So after the first shot of the MMR, you're about 97% protected. After the second shot, it's very, very close to 100%. So this is a preventable disease.
Those 3 cases last year in Texas, where were they? Were they anywhere near Central Texas or different parts of the state?
I'm not sure about that. The DSHS has that information on their website, and folks can access that.
And can you tell us about why, so with the measles case, you guys were very proactive about telling us where that person had been every single stop over 2 days, restaurants, airport. Why haven't you done that for this case?
So measles is much more contagious than rubella. So the attack rate for measles is about 90%. And that means that if you are unvaccinated and you're exposed to it, 9 out of 10 people will get measles. Rubella is much less contagious, about 10 to 30% attack rate. Therefore, it really relies on closer contact or prolonged contact for that infection to spread.
Have you notified this person's friends, family, coworkers? Who have you all talked to or reached out to?
So Austin Public Health is in the process of identifying close contacts of this individual. This includes a school in the Austin-Travis County area. Those individuals have been notified and are in the process of being notified. In addition to that, CDC notifies people who are on the flights with this individual to notify them that they may have been exposed and what to do to seek advice.
Are you able to share any more details about this person's age or what part of Travis County, anything like that?
So this individual is an adult that lives within Travis County. That's about as detailed as we can get.
Talk to us about symptoms.
So symptoms are very similar to the measles. So fever, cough, and a rash. The rash is similar to measles. It starts on the face and then goes down from there. The difference is that this rash only lasts about 3 days, which is why it's sometimes called 3-day measles. The other distinguishing factor with this particular disease is that people tend to get lymphadenopathy or swollen lymph nodes, particularly behind the ears and at the base of the neck. So this is one of the things that we teach clinicians to look for to help distinguish measles from rubella.
So if the contagious rate is lower than measles and the rash lasts only 3 days, why should we still be alarmed or concerned that we have the first case in 20 years here in Travis County?
So this disease is really a problem primarily for pregnant women. So we know that if a woman who's unvaccinated gets rubella during the first trimester of pregnancy, there's a 90% chance they will transmit that infection to their child. And that can lead to substantial birth defects, including deafness, blindness, and a number of other problems. So this is our real focus and concern.
Is this like the flu where the vaccination, although it may not be 100% effective, you get it for yourself, so even if you get a mild case, you don't also pass it on to somebody else where it could be more concerning or alarming?
That is a very important thing about vaccinations. Often people think, that disease is not too bad. Maybe I'll get sick for a little while, and they don't think about the other people, their friends, their family, and folks they don't know. They are sometimes more vulnerable, and we need to consider that when we make a decision about whether or not to vaccinate ourselves.
You had also mentioned that it is kind of like a lower level measles with a lot of people. So talk to us about how this spreads. It's like sneezing, coughing, kind of similar to that?
Yes, it's very similar to that. It's spread by contact. It's spread by droplets. This is why we encourage people to wash their hands frequently, to avoid touching their face, and to make sure they cough or sneeze into a bent elbow to try to prevent that transmission of droplets into the air where people can be exposed.
And I know that the vaccination for MMR is typically like when you're as young as 1 year old and then 4 to 6 years old. Let's say somebody's watching this and has never had. Is it ever too late to get this vaccination?
It's never too late to get vaccinated. And there's a number of resources online. We have our Austin Public Health website at austintexas.gov/MMR, or vaccinefinder.org if you have insurance, where you can locate where your insurance covers you for this MMR.
What happens if you're an adult and for some reason you don't have access to your health records, or you just can't find out if you got the MMR when you were a child? Is there a way to check if you, like, is there a test you can do? Can you go see your doctor and ask, and they can run some sort of lab test and find out?
There's testing your doctor can do if you're not sure if you've been immunized or completely immunized for MMR. That includes the measles, mumps, and rubella, and then they can provide advice on how to manage that.
And just want to clarify, so this case is not related to the measles case back in December at all. It's not the same destination, same person, same, it's not that. It's not related.
These are two separate diseases. Measles and German measles, although the names sound similar, are completely different. So these are a case of measles in 2019 and this case of rubella are completely unrelated.
What should people do if they see symptoms?
So the important thing to remember if somebody sees symptoms of rubella is not to rush to the ER or to go to their primary care office. It's best to call their pediatrician or their physician, tell them their symptoms, and then get advice. One of the concerns, again, that we have is that if people show up to clinic with this disease or with measles or even the flu, there's the risk of exposing other people. So we really want to try to limit that risk, and we ask them to call their doctor for that advice.
Will the public health be monitoring kind of like what you did with measles for the next week or so? Like if you see these symptoms, contact us. Do you have that similar protocol in place?
So rubella is infectious 7 days before the onset of the rash and 7 days after. And then there's a 23-day incubation period after that. So we'll be monitoring this throughout the middle of February before we can say we're safe from other cases.
Do you know what percentage of the Austin population is not vaccinated?
We don't know the solid answer on that. There is a resource on the Texas Department of State Health Services website which gives school vaccination rates. Primarily for the MMR, we're pretty good across the city and county, but there are pockets where we are very, very vulnerable. We have some schools, particularly private schools, that have opt-out rates approaching 50% for the MMR. So it is important also to remember that if your child who is unvaccinated goes to a school where there's an exposure, by law, they are excluded from school for 21 days. And that is not a choice. And so this is important to remember. This is a problem that parents are going to have to face if they've chosen to not vaccinate their children and there's an exposure at their school.
There was a study recently that said Travis County can be very vulnerable to a measles outbreak. As a public health employee here in Austin, is that concerning to you?
It's very concerning for us that we have such a substantial exposure to something which is almost completely preventable. There has been a lot of misinformation on social media, particularly over the past 5 to 10 years, and that's not backed up by scientific fact. And so I encourage folks to talk to their physicians, to their healthcare providers, and to consult experts like the CDC and the World Health Organization before they make decisions about vaccinations.
Anything else that you think we forgot or you'd like to add?
Flu shots are good. MMRs are good. I don't think so.
Thank you.
You bet.
Thank you very much.
Hey there, everyone. Will Dupree once again in the KXAN live studio. You were listening just a few moments ago to Dr. Mark Escott, the Interim Health Authority and the Medical Director for Austin Public Health. That particular agency sent out a notice earlier today saying that Travis County had its first confirmed case of rubella since 1999, and this comes just a few weeks after Travis County also had its first confirmed case of measles since 1999. However, the medical director there had said that these two particular situations are unrelated, so that's some good news to pass along there. He also mentioned that this case of rubella is much less contagious than a measles case is. So they are monitoring people around this person who was infected with that viral infection there, and they are monitoring it very closely and getting in touch with people that might have ridden on the plane with this person. Important to note that the medical director there from Austin Public Health said that the person who obtained rubella in this particular case had traveled to Thailand and back and then brought it over in that situation. He said it's a very rare situation that we see many of these cases in the U.S. There are less than 10 in the U.S. on average each year. He said there were only 3 in Texas last year, so this is a very rare thing as well. But it's completely preventable to protect yourself from rubella, from the measles. All you need are the series of MMR shots. Clearly, this person was not vaccinated, but the Austin Public Health and its experts are urging people to get those shots to protect yourself from these kinds of things. That's why there are so few cases in the U.S. usually and here in Texas.